Thankfully, the University of Michigan Maternal Fetal Medicine agreed to pilot a program with us. And so patients that we feel are high-risk pregnancies can meet with one of those physicians over the computer and save them trips all the way down to Ann Arbor. And they have met with patients even before pregnancies where we think their pregnancy might be high risk, and they can start talking about preconception issues. Well, the patient advantages definitely seem to be saving time for travel. Sometimes the weather is bad, and so they don't have to drive all the way down to Ann Arbor, which is safer, but also cost. Patients are saving a lot of money not having to drive down and stay in a hotel. Being able to meet with the specialists while keeping the patient in Alpena helps us because the patient is more likely to undergo that visit. And we also share the same electronic system, and so then we get reports back from their physicians immediately. Definitely helps us take care of patients better. The common things that our patients will see maternal fetal medicine for are pre-existing diabetes, chronic hypertension, a history of pregnancy complications. We also have patients see them if they have different heart diseases, which put them at higher risk for the pregnancy. So by seeing the maternal fetal medicine, they do help us come up with a plan for the pregnancy, albeit either lab test or imaging the patient may need. One example that I can think of where the patient definitely benefited was one of the preconception counseling. We were taking care of a patient who was having miscarriages, and we were doing everything that was up to date for the patient, but she definitely felt more comfortable being able to talk to a high-risk obstetrician, and it gave the patient reassurance that everything was being done for her and her spouse, and definitely helped ease some anxiety. One of the things some patients may be concerned about is feeling that they're talking to either a robot or because they're not with the provider, but actually after just a couple minutes of talking, patients kind of forget that the practitioner is not there and not in the room with them physically, and they get comfortable, and all of our patients have had very good experiences meeting with the providers over the internet. Some of the future applications we're working on and hopefully will be live within the next year is being able to do the ultrasounds over the internet as well, so a patient won't have to travel downstate to get a specialized ultrasound performed.
Thank you for watching one of many short videos in our new telemedicine mini-series. I encourage you to watch the remaining videos as they are published. Each of these will highlight just one more way that Mid-Michigan Health and its partners are providing access to healthcare in our communities. For more information, please visit our webpage at midmichigan.org/telemedicine.